Hello. In today's section, we will be looking at briefly the standing orders, the current national standing orders prepared by the Community Health Practitioners Regulation Board of Nigeria, alongside with the National Primary Healthcare Development Agency. This all-important document, as emphasized, serves as a guide, but do not replace your clinical thinking as a clinician. So now, that makes it very important that as students, we should be reading our standing orders to enhance mastery of the content of the standing orders. So if you have not started, I think you are making a big mistake. You should go back, start to go through your standing orders to enhance mastery. The standing orders has sections for the newborn, for the early childhood, for the late childhood, for adolescents, for adult, and for elderly. The pointer is the age given. 0 to 28 days of life is the newborn or the neonatal period. Then 1 month to 5 years early childhood. Then 6 years to 12 years late childhood. Then followed by the adolescent period, that is the teens, for 13 years to 19 years, while adulthood starts from 20 years to 59 years of age. Although some school of thought says 64 years. So, but for the standard, that is what we're taking. Now, that is the pointer. When the examiner gives a particular complaint, that is the pointer that will tell you where you are going to look up the complaint in the standing orders. Now, in the standing order, it's also important you note some key things. For example, the history. As you're seeing here, this history is meant for every complaint that is given under diarrhea and its related causes and alike. So all the history here serves for it. How long have you been ill? How many stools do you usually pass each day? Have you passed any since morning to before coming to the clinic? Are the stools watery? Is there blood or mucus? What is your source of drinking water? What type of toilet facility do you use? All of these things are pointers. Let's take them one by one. How long have you been ill? It's a pointer that tells us if that condition has been chronic or acute, which might require here at upper level. So therefore, you have to give first aid and refer. Or which can also be a pointer that we can manage. Or which can also be a pointer that there is possibility of us giving this child an IV line. So your brain begins to what? Open. Then, how many stools do you usually pass each day? This is to determine if it is chronic, if it is acute. If it's acute, baby can die within 24 hours, or the child can die within 48 hours. So it's a pointer. Then, have you passed any since morning before coming to the clinic? This is to estimate what to expect and the intervention you must give to resuscitate the cardiovascular system, because diarrhea leads to loss of fluid in the body. Now, you go forward to are the stools watery? That if it is watery, it could be cholera, it could be any other cause. Then what is our fear? Possibility of shock due to loss of fluid. So you start to think, then is there blood or mucus in the stool? That will tell us if it is dysentery. If it is blood, it could be Escherichia coli. It could be other hookworm. It could also be any other cause that can lead to bleeding. It can also be salmonella. So it begins to give you a better idea of what to expect. Then, what is your source of drinking water? It could be waterborne disease that is leading. If the source of the water is one that is prone to pollution like stream, you might suspect cholera. You might suspect Escherichia coli. You understand? Then, what type of toilet facility do you use? If they are using open defecation, no toilet, there's possibility of continuous fecal oral transmission in that community. And as a committed practitioner, it's a pointer of community intervention, community mobilization, and every other thing. Then, are you nauseated or have you vomited? That will tell you if the person is stooling and vomiting, it is a pure indicator of a severe condition, because the person will be losing bicarbonate from the stomach via vomiting and passing the rest through stool, and that child can easily tilt towards hypovolemic shock, and therefore it's now a pointer that this is gastroenteritis. So therefore there's a bacteria that is responsible. Then, do you have fever, abdominal pain, or cough? If there is fever, it's a pointer of infectious origin. If there is abdominal pain, we begin to look at, could it be hookworm? Could it be any other cause? If there is abdominal pain with blood, it is another pointer. So the same way, all of these questions are very important. For example, is there anyone else in the household who is sick? It's a pointer to note if there is infectious diarrhea, secondary transmission, secondary attack rates. As a community practitioner, that helps you to calculate, to project yourself into the community, to look at, okay, this could be, there's a secondary infection, and what's the source of this infection? Then, have you taken any medication or treatment for this? If there is treatment taken, then you ask what. That will help you to know. If they have taken a lot of Flagyl and all that over-the-counter drugs, and it's not stopping, that should be a pointer that there is need for change or any other thing. Also, when you ask for if they have given any medication, it's also a pointer to know if they are going through traditional drugs. And most of the traditional drugs do not work well with the orthodox medication. Then, have you eaten plenty of fresh fruits, mangoes, or plenty of pepper? All of these could be an aggravator or something that's aggravated. So we are trying to look in a broad way. History brings us in a broad way as we begin to narrow down. So when you take a good history, you already have an idea. So as you're asking these questions, you are writing, there is fever, there's no fever, has stood for 7 days, have taken a paracetamol, have taken Flagyl, there's no blood in the stool, there's no mucus in the stool. As you're noting them down, it's pointing towards a particular diagnosis. Then, these are the expected history you must take to help support the physical, the history you have taken. This is the physical assessment you must perform to help support the history you have taken, and which will help narrow you down to the likely cause of the patient or the client's problem. Now, general appearance. Is the patient alert, restless, irritable, thin, dehydrated, lethargic, and unconscious? These are pointers of the severity. If the person is irritable, that means the person is almost going to shock, is losing himself. So therefore, there's need for urgent rehydration. Then, is the eyes sunken? Is it normal? Is it dry? Is the mouth and the tongue moist, dry? Is the respiratory rate high? You have to check for respiratory rates. If it is high, that means actually this person is tilting towards shock because they have lost a lot of fluid, and therefore the body requires enough oxygen. And because of the shift in the fluid balance in the body, that could precipitate increased respiratory rates. Then it could also be that the person has been passing blood, and that the body is now anemic. Then the neck region, the lymph nodes, the throat, and this will help you verify if there is an acute infection, an acute respiratory infection, acute infection that passed through the mouth is a pointer. Then is there ear discharge and all of that? Then abdomen, is the abdomen tender? You're trying to rule out His abdomen tender because there are a lot of things that can lead to diarrhea, but may not be watery diarrhea. You understand? There are a lot of things that can give diarrhea, but may not be watery diarrhea. So you check for abdominal tenderness and distended. It could be other problems of the abdomen, so intussusception and every other thing like that. So then you check the skin, you pinch. If it goes slowly, it could be an indicator of dehydration. They check the weight and take the temperature to rule out infectious diseases. So this history serves for the complaint under this. This history and the physical examination serves every complaint that will fall under this diarrhea. Remember, diarrhea can be watery and is defined as the passage of watery stool more than 3 times a day. You understand? So now, when you have performed this physical examination, you understand, it will help guide you. So you have to adapt, like I said earlier, adopt this examination and also adopt the history to suit the complaint the patient comes. Let's say, as this patient came here with sudden onset of frequent watery stool, you are expected to ask these questions. You understand? All the questions. Then you check for general alertness. It's key. You check for the eye. You check the dryness of the mouth. You check respiratory rate. You check the skin for all these questions. You check temperature. You weigh, and you carry out neck examination. Now, by the time you conduct this examination, and these are the things you found. These are the things you found. Weak with severe dehydration, skin pinch goes back very slowly, tongue very dry, and with very sunken and dry eyes, tears absent. Now, which is a pointer of a severe form of dehydration from diarrhea. So you are expected to make use of this action here. Take IV line with Ringer's latex immediately, 100 ml per kilogram body weight. We call it bolus. Then you take all of these actions here. You see. Now, let's say the person also came with, another patient came with a different complaint of frequent stool and vomiting. And in epidemiologically speaking, as a community practitioner, that area is facing the outbreak of cholera. And you take these histories, here, and then they are pointing, and the physical examination you have taken are also pointing to this. By the time you conducted the history, you wrote down and you examine as above, and these are the things you found. Irritable, sunken eyes, mouth dry, tears absent, and the patient drinks eagerly. Skin pinch goes back slowly, some dehydration seen. Then you make use of this box to handle the patient. You make use of this box to handle the patient. You see, so frequent stool and vomiting. This is the complaint the patient presented. Then you go back and take those histories as given above, perform those examinations that is a pointer of dehydration, diarrhea. Then, and you found that the patient is irritable, sunken eyes, mouth, tongue dry. Then you use this box to treat. You see, if no improvement, refer. Give IV fluid as above. Give oral dehydration salt. Give amoxicillin, metronidazole, sulfate, zinc sulfate, and metoclopramide. Then, if no improvement, you refer. Let's also assume that the patient came with complex frequent stool with visible blood and some dehydration. From this complaint alone, you don't need to go back to history and be asking the patient again, is there blood in the stool or mucus? No. The patient have said, I am passing through stool that is having blood in it. So what you need to do is to take other histories, then perform all the examination. Then after taking the histories and performing the examinations, you are noting down the findings. At the end, if the findings you've noted down concurs with irritable mouth and tongue dry, skin goes back slowly, and judging clinical wise as a clinician, it falls within this, then use this box to manage the patient. The same way, in all the complaints, you are expected to take the history, adapt the history to that patient's complaint. This is usually complaint. Then, as you take your history, perform a physical examination of the patient as provided above, you are noting down your findings. And these findings will tell if you are going to use this box for the management of that patient. For here, I see the patient maybe is alert after you perform an examination. Eye is normal, mouth and tongue only moist, child drinking, and skin goes back immediately. So here, you just have to demonstrate mother how to prepare ORS and administer. You encourage the mother to continue to breastfeed. So what are we trying to emphasize? Taking of good history above and performing those examinations is a great pointer that will enhance the arrival of diagnosis, although presumed or a working diagnosis, then the actions that you must take. So it's important you understand this. Then at the end of the whole thing, for any of the complaints you give to the patient, you must also support it with health education. So you're going to advise the parents or caregiver on personal hygiene. This is where your skills on education, community education of the patient is very, very, very important. You have to educate the patient on personal food hygiene, adequate nutrition, how to prepare sugar source solution, then water sanitation, and every other important thing that is listed, depending on the complaint you are handling. Then at the end, always give the patient or client the opportunity to ask questions so that he can clarify, and always let the patient know to come back when the condition gets worse and all of that. Provide that avenue for feedback and follow-up is very important for the continuity of care of what patients. So with this, I believe you can now understand and use the standing orders very, very well. So I encourage you to go back, try as much as you can to study all the history and all the physical examination provided. Learn the skills there. It will help you in making informed decisions that will help the patient. The other things I would want to say, there are some complaints in the standing orders that are funny. They would say, or they would give a complaint like this. They say, patient with fever and any of the following. Most times, students find it very difficult because they will be looking out for the complaint that contains everything. For example, maybe a particular boss has fever and any of the following: headache, rash. The examiner might just come up, give you examiner might just come up and just give you a complaint. A child who is 3 years and 5 months old is having fever with vomiting, unable to drink, convulsion. He did not add stiff neck. And you'll be looking out for, and you saw stiff neck in this one and not use it. Always read that part. Says fever with of the following. Headache with any. So it means if they list vomiting, unable to drink, convulsion, history of convulsion, stiff neck. Once there is fever and there's convulsion, use that box. Once there is fever and there is unable to drink, use that box, because it says fever with any of the what following. Most times it gives students headache and they find it very difficult to locate the complaint. Then, like I said earlier, sometimes they also give you a complaint saying with or without. For example, a female child of 11 years was brought to your health center with a complaint of headache with or without toothache. So what it means is that if the patient presents with toothache, manage with that box. You understand? If the person does not present with toothache but presented others, manage. So let us be careful with that word, with any of the following, with or without, so that you don't waste much of your time looking out for a complaint and your time goes up. Thank you. I believe this section have provided you a little knowledge, and we are open to criticism and feedback. Thank you and have a wonderful time. See you next in the next